So too often I get pets brought to me at the vet clinic that have been sick for a long period of time and are actually really near death. And if only they had been brought to see me sooner, the outcome could have been so much different. But it can be really tricky for pet parents like you to know something is wrong in the early stages of a problem, or to tell if a treatment they are getting is actually working. Caregiver placebo is a really powerful concept that I've spoken about before, and I'll leave the video linked on screen. So wouldn't it be great to know that your pet really is healthy or that their treatment is working? I spoke to Guilherme Coelho, the CEO of pet company Maven, all about the power of early intervention using the latest in pet technology. And I started off by asking about his personal experience with his own dog.
You were aware that this was a potential issue with your dog and you knew what to look for, but even then it kind of crept up on you unawares. And I'd probably say actually with the options that are available now, you may have got it months, even years in advance compared to, you know, when you were tackling that problem.
Yeah, for sure. We know pets don't talk, right? And we know as pet owners, we struggle with trying to interpret our pets, right? We don't know if they are okay, if they are in pain, if something is wrong. And the best way to help pets communicate, it's through technology, right? It's through wearables, through other sort of devices that we can get a better sense of what's going on with the pets, right? And we know that they are very good at disguise when something is wrong, right? Particularly cats as well. And so being very granular and being able to detect like these incremental changes that happen on a daily basis, it's like a crucial step towards being proactive on our pets' health and well-being.
Yeah, absolutely. I mean, from my point of view as a vet, it can be incredibly frustrating because I'm seeing my patients when they're often brought in at the very end stages of their disease. And that's not a criticism of all of the pet parents out there. It's incredibly difficult. Our pets just get on with life. They hide their illness. They still eat. They still want to chase the ball if they're even remotely able. And so these signs can be very difficult to pick up on. And then you've got the fact that you're living with them every day. And so that slow progression is just really bad. And then that gets to a stage a bit like your situation where the options available are maybe not nearly as good as they would be even a month or two in advance. And, you know, I think there's a lot of comparison with human healthcare in the veterinary field, but our doctors are very lucky because we'll go to the doctor personally much sooner than we'll notice a problem in our pet. And like I say, that's not a criticism. So with this technology, so we've said wearables, I guess the most common comparison is with the Fitbit, with the step tracker, but it's so much more than that. What are we talking about when we're talking about wearables?
Yeah, so Maven is not just an activity monitor, right? So, I mean, we do measure the amount of miles, kilometers, whatever it is, calories burned. I mean, those things are relevant, but they are actually more relevant for the pet owner than they are for, like, clinically speaking about the health of the pet. Maven is unique because of our position in terms of technology. We can be very granular on the data that we collect about the pet, right? So we have like hundreds of features that map out what's the normal behavior for that pet, okay? Throughout the day, throughout the night, different access, different intensity, different levels, how fast the pet goes between levels from minimum to maximum, things like that. So it easily gets complex, and each pet is a pet. Even the same breed, the same age could be entirely different depending on the pet owner, depending on the lifestyle. And so we have like a pet specific approach, and we've built algorithms capable of detect changes on each pet behavior, right? So we learn what's normal for each pet, and then we proactively look for changes on the pet behavior, right? And changes could be things simple as the pet being like less intense in the movement. Okay, so if it's an 8-year-old pit bull, for example, and suddenly the movements aren't as intense as they used to be, okay, most likely this pet could be dealing with some sort of osteoarticular problem, right? Could be signs of the pet being restless in the middle of the night. So the pet is dealing with discomfort or waking up more often to drink water, whatever it is, right? Our goal is always to detect changes on the pet behavior that might have a clinical meaning of what's wrong.
So you mentioned there kind of, are they lethargic or their activity levels, but is it able to pick up the different movements for different activities? So I'm thinking, you know, when it's eating or when that dog's drinking or when they're scratching, because they're all presumably quite different movements. And yeah, it's not just measuring just solely activity or steps, if you like.
Yeah, so because we are very granular on the data, because we have like these 100 features to map the pet's behavior, we are doing some tests precisely to be able to detect those changes, right? Scratching is a very intense and quick movement, and our preliminary tests tells us that we can easily detect scratching. And so as we go, as we have more scale, we do want to label more specific behaviors such as drinking, eating, as you mentioned, right? So today, from those 100 features, we map like deep sleep, quiet, active, excited, running around, playing, whatever it is. But we want to be very specific because like eating, drinking, and scratching are super relevant in terms of clinical validation, right? The same thing for respiratory rate. I have enough data and I'm granular enough to detect changes when the pet is at sleep, like midnight, pet is completely still, okay? I can detect slight changes on the sensor from which I can then extrapolate respiratory rate.
An example of how useful that can be, with that respiratory rate when they're asleep. So a dog that's in heart failure, actually sleeping respiratory rate is an incredibly accurate and valuable tool that our pet parents have. It can be a bit difficult to get that consistency of when they are in deep sleep. But you're right, just picking up a very slight increase. So the cutoff that we use is over 30 per minute, but actually for that specific animal, it may be that change from 18 to 22 is significant, and we can jump in with modifying that treatment plan at a much earlier stage than the dog coming to us when it's gasping for breath because its lungs are full of liquid. So that is incredibly powerful. And then the being awake at night, we've got a known allergic dog. Well, chances are, there's a number of other things, but they could be scratching all night and you might not see them as a pet parent because you're out of the house in the day, but in the dead of night when they don't have all that distraction going on and they suddenly feel incredibly itchy. So how powerful this can be for a whole number of conditions.
To learn more about how wearable technology can impact the health and well-being of your dog, make sure you tap on this video linked on screen. So tap on that video and I'll see you there. But until the next time, I'm veterinarian Dr. Alex. This is Our Pet's Health, because they're family.